If you're over 60, you probably have a box of baking soda sitting somewhere in your kitchen or bathroom cabinet. But what if I told you that same little box could help relieve acid reflux, soothe itchy skin, protect your kidneys, freshen your breath, reduce joint pain, and even help prevent urinary tract infections? And all of that without a single prescription or expensive supplement. This isn't some internet rumor, it's simple science, and the evidence behind these benefits is growing stronger by the year. The truth is, baking soda, sodium bicarbonate, might be one of the most overlooked remedies for seniors facing multiple health issues. In fact, many doctors quietly recommend it to patients dealing with kidney decline or stubborn acid reflux when medications stop working or cause side effects. In this video, we're going to show you exactly how to use baking soda safely and effectively, and why it's helping more and more older adults relieve 6 common problems that affect aging bodies every day. From inflammation to infection, from digestion to detox, baking soda could be the inexpensive tool that changes your daily health routine. Now, let's start with the issue that affects millions of seniors every single day: acid reflux. You've probably felt it: the burning in your chest after a meal, that sour taste creeping up your throat, sometimes even interrupting your sleep. It's one of the most common digestive complaints in older adults, and for good reason. As we age, the muscles around the esophagus weaken, stomach acid production can shift, and many medications we take make reflux worse. While antacids and proton pump inhibitors are often prescribed, long-term use has been linked to nutrient deficiencies, bone loss, and even kidney damage. Here's where baking soda comes in. Just half a teaspoon of baking soda mixed in a glass of water can quickly neutralize excess stomach acid. It works fast because it's a natural alkaline compound that balances the pH of your stomach contents. For some people, this simple remedy provides almost instant relief, which is why it has remained a household standby for generations. But don't overdo it. Too much can raise your sodium levels and upset your body's electrolyte balance. That's why it's best used occasionally or as directed by your doctor, especially if you have high blood pressure or are on a salt-restricted diet. Even better, if you're looking to reduce your dependence on over-the-counter heartburn medications, talk to your doctor about using baking soda in rotation with lifestyle changes like smaller meals, early dinners, and elevating the head of your bed. The second surprising use is for itchy, irritated skin. Seniors often deal with dry skin, eczema, or rashes due to thinning skin, lowered oil production, or sensitivity to soaps and detergents. And while many creams and ointments are available over the counter, few are as affordable and naturally soothing as baking soda. Its anti-inflammatory and alkaline properties make it an excellent remedy for calming skin irritation. Adding half a cup of baking soda to a warm bath and soaking for 15 to 20 minutes can reduce itchiness, redness, and discomfort. It's a gentle, drug-free way to support skin health without resorting to steroid creams or antihistamines. For targeted relief, you can also make a paste with baking soda and a little water and apply it directly to bug bites, mild rashes, or areas of inflammation. Many seniors have also used this method for heat rash, chafing, or even mild sunburn. If you have particularly sensitive skin or open wounds, always do a patch test or ask your doctor first. But for most people, this method is safe, simple, and surprisingly effective. One common tip is to combine baking soda with colloidal oatmeal or Epsom salt in the bath for added relief. The combination can help rehydrate skin and restore a healthy pH balance. Third, let's talk about your kidneys. Chronic kidney disease affects nearly 40% of people over age 60. While most don't realize it until the damage is advanced, early intervention can slow the decline. One of the most promising therapies being studied is bicarbonate supplementation. That's right, baking soda. The kidneys are responsible for regulating acid levels in the body, and when they weaken, acid builds up, damaging tissues further. In clinical studies, taking small amounts of baking soda each day slowed kidney function decline and reduced the need for dialysis in some patients. This is especially important for seniors who have high blood pressure or diabetes, two of the most common contributors to kidney disease. Of course, this must be done under medical supervision, but it shows how powerful this basic household compound can be. In one long-term study, patients who took a daily bicarbonate supplement preserved more of their kidney function compared to those who didn't. The researchers believe baking soda reduces metabolic acidosis, a condition that accelerates kidney damage. If you're concerned about kidney health, have your doctor check your eGFR and talk with them about whether a low-dose bicarbonate supplement might be right for you. You can also support kidney health by staying hydrated, eating less salt and protein, and managing blood sugar if you're diabetic. Baking soda may not reverse damage, but it might help you slow it down.
Number 4. Oral health. Seniors often struggle with bad breath, dry mouth, and gum sensitivity, especially if they wear dentures or take medications that reduce saliva. Dry mouth creates the perfect environment for bacteria to thrive, which can lead to cavities, gum disease, and persistent odor. Baking soda can help here too. It neutralizes odors, balances pH in the mouth, and gently scrubs away plaque without damaging enamel. Simply brushing with a baking soda paste or using a solution as a mouth rinse can freshen breath and improve overall oral hygiene. Some seniors even use a mix of baking soda and hydrogen peroxide as a natural whitening paste. However, moderation is key. Avoid brushing too hard or using it excessively, which could wear down enamel over time. A good tip is to alternate between your regular toothpaste and a baking soda rinse a few times a week. You can also add a pinch of baking soda to your denture soak to remove odors and neutralize acids. If you have sensitive gums, consult your dentist to ensure this method won't irritate your mouth. Still, for most people, this is a gentle, inexpensive way to enhance oral care.
Next, let's talk about joint pain. Inflammation is a major cause of joint stiffness, swelling, and discomfort in older adults. Recent research has shown that baking soda may encourage the body to produce more anti-inflammatory compounds by influencing immune cell behavior. In one animal study, a small daily dose of baking soda appeared to shift immune cells from pro-inflammatory to anti-inflammatory states, which helped reduce systemic inflammation. Though human studies are still limited, the findings are promising. A small daily dose, under supervision, might help reduce chronic inflammation, which is a driver of conditions like arthritis, metabolic syndrome, and even cardiovascular disease. Again, this isn't a replacement for prescribed medications or physical therapy, but it may be a helpful addition to a broader plan for managing joint pain. Seniors who already use anti-inflammatory diets or supplements like turmeric, omega-3s, or green tea extract may find baking soda enhances those benefits. Finally, we come to urinary tract health. Seniors, especially women, are more prone to UTIs due to changes in bladder function, immune defense, and hydration levels. Recurring infections can be painful, frustrating, and dangerous if left untreated. Baking soda can make urine less acidic, which may reduce burning during urination and make the environment less favorable for bacterial growth. While it's not a cure for infections, using a mild baking soda solution as a short-term measure could ease symptoms and support prevention alongside proper hydration and hygiene. For example, mixing 1/8 teaspoon of baking soda into a glass of water and drinking it once or twice daily for a few days may reduce discomfort. This should never replace antibiotics if your doctor prescribes them, but it may help bridge the gap while waiting for treatment or after completing a course of medication. Always speak with your healthcare provider before trying this remedy, especially if you have high blood pressure, kidney issues, or are on a low-sodium diet. So there you have it. 6 common problems that baking soda can help relieve: acid reflux, skin irritation, kidney function, oral health, joint inflammation, and urinary discomfort. This simple, affordable remedy has been quietly helping people for generations, and now modern science is finally catching up. From bath soaks to mouth rinses, from immune support to digestive relief, baking soda continues to prove itself as one of the most versatile health tools in your home. If you're considering adding baking soda to your health routine, do it smartly. Use small doses, monitor your sodium intake, and always talk to your doctor if you have underlying conditions. Also, make sure to get your baking soda from a trusted source. Look for food-grade labels if you're consuming it, and avoid using products that contain added chemicals or scents. Let us know in the comments if you've used baking soda for any of these issues, or if you found another natural remedy that works for you. Your experience could help someone else find relief. And don't forget to like this video, subscribe to Silver Seniors Health Tips, and turn on notifications so you never miss out on our next practical, science-based tip. I'm Dr. Dan Mercer, and I'll see you in the next video.